Hi there everybody, we're gonna start with the liver diseases, but please remember that in the acute viral hepatitis, the ballooning degeneration and the Councilman body, they are the important characteristic for the pathology. On the other hand, the piecemeal necrosis are the characteristic for chronic active hepatitis. We're gonna study the 5 famous hepatitis viruses, and we're gonna start with the hepatitis A virus. The pQRNA non-envelope contain RNA. The ALT/AST may exceed the value of 10,000, and the ALT is exceeding the AST. On the other hand, the hepatitis B virus, hepDNA virus, enveloped and contain DNA. And on pathology, the ground glass appearance are the characteristic for the hepatitis B virus. Hepatitis B virus, also called the serum hepatitis. The anicteric hepatitis is the predominant form of the hepatitis B virus. Chronicity means the presence of HBs antigen for more than 6 months, while presence of HBe antigen indicate the high replication and sign of chronicity. The HBV/HDV co-infection, the most common outcome is complete recovery, while on the other hand, the HBV/HDV superinfection is associated with more severe clinical outcome. The third one is a hepatitis C virus, the flavi-RNA virus, and most patients go to proceed to chronicity. The fluctuation in ALT is characteristic for HCV, and as we said, the chronicity and cirrhosis and even HCC is the HEV or the enteric hepatitis. The case fatality rate are high in pregnant women. We're gonna proceed to the alcoholic hepatitis, and the pathology change, the fatty change, neutrophil and Mallory body are characteristic for the alcohol hepatitis. In progression of alcohol hepatitis, the stellate cell activation lead to collagen and fibronectin laydown. The spectrum of NAFL, which is the fatty, simple fatty liver, and the NASH. Autoimmune hepatitis divided into 3 types according to presence or absence of certain marker. Note that the overlapping between autoimmune hepatitis and other diseases such as primary biliary cirrhosis, which passes through 4 stage, and the characteristic presence of the AMA for the primary biliary cirrhosis. On the other hand, primary sclerosis cholangitis, note that presence of P and K is the characteristic, and the ERCP is the standard for confirming the diagnosis. And on pathology, the onion skin fibrosis, also characteristic for primary sclerosis cholangitis. Other entity of disease, the metabolic Wilson disease, AR13 due to mutation in Wilson disease protein or ATP7P gene. The characteristic Kaiser-Fleischer ring, and maybe we can find the hyperdensity on the basal ganglia also in Wilson disease. The hereditary hemochromatosis, ARP6, due to mutation in HFA gene, and lead to excessive iron accumulation in certain organ, and of course that organ will be the liver. First of all, the liver, then the adrenal gland, and heart, and pancreas, and each has the specific sign and symptom for that disease. Transferrin saturation will be the initial test of choice, and of course the genetic testing and biopsy to confirm the diagnosis. Third one is the alpha-1 antitrypsin deficiency due to mutation in the SERPINA1 gene, and most patients with alpha-1 antitrypsin deficiency have the homozygous SS or the ZZ. When the serum alpha-1 antitrypsin less than 80, the patient are likely to develop emphysema Chiari syndrome, triad of hepatomegaly, ascites, and abdominal pain due to thrombotic or non-thrombotic obstruction to hepatic venous outflow. Duplex ultrasound will be the first initial test to do, and of course the hematological study. The goal of therapy is to decompress by tips and treatment and detect the underlying cause. On the other hand, hepatic veno-occlusive disease occur typically due to toxicity of pre-operative regimen of bone marrow transplant, and again the duplex ultrasound will be the diagnostic imaging study of choice. Please note that micronodular cirrhosis occur in processes that affect the liver equally, while on the other hand the macronodular cirrhosis processes that affect the liver unequally, such as active chronic hepatitis.